inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Sherry Chen is a scientist, and she won national awards from our country, and she's a good person. Just because she went back to China to visit her old parents once and came back, and how can you accuse her of spying for China? And this is wrong. I think this is a part of profiling, discrimination against Asian American.
A case involving Sherry Chen, a former employee of the National Weather Bureau, has put Cincinnati in the center of the national and international controversy. Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. Sherry Chen, a Chinese-American scientist, worked as a hydrologist developing models to predict flood levels for the U.S. National Weather Service in Wilmington, Ohio. Chen was accused of espionage after returning from a trip to China in 2014. Although all the charges were dropped without explanation, in May 2015, the Weather Service fired her in September. Chen is fighting that dismissal, and her case is now before a panel of U.S. Merit Systems Protection Board sitting in Cincinnati. Though the roots of this dispute occurred during the Obama administration, the case of Sherry Chen has drawn the attention of national and international rights groups and is playing out in the heightened anti-immigrant, anti-Chinese atmosphere of the Trump administration. I'm joined now by Shau Zavon, a U.S.-China business consultant, a founding board member of the National Council of Chinese Americans, and the founder of the Greater Cincinnati Chinese Chamber. She is currently the treasurer of the National Council of Chinese Americans. Wang is the head of the Ohio American Asian Association. He lives in Columbus and has joined us this morning and works for a cable program, or cable network, pardon me. Michele Young is an attorney who ran for Congress last year in Ohio in the 1st District and has become involved in the struggle for justice for Sherry Chen. Welcome to everyone.
Thank you.
Welcome back, Michele.
Thank you.
And let's begin, Shau, with just who is Sherry Chen? I mean, what's her background? Is she an immigrant? Was she born here? She's a scientist, a hydrologist, whatever the heck that means. So tell me a little bit about the person in the middle of this.
Well, Sherry Chen is an award-winning scientist who worked for the National Weather Services in Wilmington, Ohio, right here. And she was born in China, but she has been a citizen of the United States for over 17 years.
Okay, so she's an immigrant and she's a citizen.
Yes.
Okay, and she's a scientist. And how long has she worked for the Weather Bureau?
Well, she's been working for them for a long time, as far as I know. And in 2011, she won an award, by precisely predicting the model of the flood level, and it saved thousands of people and properties.
Okay, so this predicting flood levels is she's helped work on this model.
Yes.
Vince, when she went to China, my understanding is that she went there primarily to visit her parents.
Yes.
But then interacted with a former scientific colleague. What happened that drew attention to this case?
When she visited her family, and her family introduced her to a alumnus of her alma mater, Tsinghua University. That person happened to work in the same scientific area, hydrology. They started a casual conversation about hydrology in general, and also when the person learned about her work, he asked her about the question in general. He was asking, how do you guys estimate the cost of dams? That started.
So estimating the cost of dams. And building dams is a big thing that's happening in China as it modernizes. Having been there, okay.
Right. he was asking her about whether she has some general knowledge, whether she saw some kind of public literature about it. She said, I can take a look at it, whether there's any public information. And when she came back from China to her work, and she also talked to her supervisor about it. Her supervisor was very supportive of the conversation from an academia perspective, and also pointing her to several public sources for her to take a look. She was able to find some information publicly available, share with the person in China. That caused some person in her workplace to falsely accuse her of espionage.
So actually, she came back here, and the work that she was doing it here with her supervisor's full knowledge. And this was public information. It was about the cost of building dams.
Yes.
So this isn't even about the technology so much. It's a cost question.
And the funding, I think.
And the funding question.
It looked like a witch hunt, because if the espionage, they spent a year trying to find proof of espionage. They never did. In the end, they grasped at straws, which happens when you're targeting a person for racial reasons, discrimination reasons, or for whatever reasons, grasping at a straw to explain what was the shocking persecution of a hard-working, award-winning scientist.
Well, okay, so you're an attorney. The case was dropped. They charged her, but they never tried her. The case was dropped with no explanation. And then, a few months later, she's fired. So, as an attorney, what's that look like to you?
As an attorney, not on the case, it looks like retaliation. It looks as if something that was ghastly, that went against everything that's American, which was to treat a hardworking immigrant and American citizen as if she was a suspicious foreigner. When that was all done, and thousands and thousands of dollars of taxpayer dollars were spent on this, and a woman's life was destroyed and her reputation, instead of saying, hey, we're really sorry, which is what the New York Times asked for, Washington Post also pointed in that direction, even 60 Minutes, Congress people, civil rights organizations across the country said, give us an explanation. Instead of an explanation, doubled down and said, well, you know, she used a password. She didn't ask permission. She was the only person. Password was nothing. And by the way, everyone in the office had it. Third, her supervisor gave it to her and was not disciplined. So what she is fighting is that this was done because she's Chinese. And is this a isolated incident, or Shau, are there other incidents in the scientific community, or Vince, either one of you, where Chinese American scientists have been targeted?
Definitely. I think the reason that we step forward and support this issue is because it's a national issue and international issue. It's not just an isolated Chinese American issue. I think it's an all-American issue as well, because there's a pattern of targeting people based on their race, ethnicity, and the national origin. And another example of this is just recently, in 2015, another scientist, a professor of Temple University, Mr. Shao, also got targeted and investigated and was arrested for no reason. He woke up one morning, and heard the door knocking so hard, and he didn't even dress himself up fully, and went up, opened the door, only to find out several police people, FBI agent, putting the handcuff on his hand. He was so shocked, no explanation, and then the case was dropped. In 4 months, in September of 2015, it dropped. No explanation, nothing. The only thing that is better off than Sherry is he didn't get fired.
Well, one of the last week on here, I had two scientists, and one of the things that we were talking about is that science by its nature is global, and communications across national boundaries happens all the time. That's how science is done. So it's interesting, the echoes here of, now one of the things I want to get back to, and I hinted at this, was, in my opening, is that this started under the Obama administration. This is not something that started under the current administration where everybody,
Right.
So this is something that is endemic across administrations.
There appears to be a trend now to target Americans who come from different countries or of different color, different faiths, Chinese, Muslim, Indian. It can be any faith, any background, but to be targeted as if suspicious for one reason or another. And this is keeping with what is a very, very frightening and dangerous trend, and one that has, in the situation of Ms. Chen, the targeting has been of innocent scientists like her and others all across the nation, just sharing innocent information. Terrible.
Vince, what does Sherry Chen want at this moment? She has a hearing that's going on, and we're recording this on Friday morning. She could not be with us for a couple of reasons. One, probably not the time for her to come public and talk about this. But secondly, they're literally taking testimony today. But what does she want as to repair what has happened?
Sherry Chen is a award-winning scientist. She has her whole passion for her life to dedicate to this career. She's a talented woman, and she wants to get her job back and start getting back to her work and continue contributing her talent to the country to serve the people.
Is this the kind of thing that, having gone through this, would prevent her from getting a job in with other agencies? I mean, not just federal agencies, but agencies in general. This is the sort of question that's hanging over her now, that unless it gets cleared up, because when the case was dropped, there was nothing said about
That's
why
right.
it was dropped.
Right.
Nope.
Yeah.
Nobody said, we're dropping this because we don't have any proof.
Yeah. As a matter of fact, because her model, hydraulic model, was so successful, a lot of government agencies, they wanted to collaborate with her on building like enhanced model for their different areas of focus, and also a lot of universities. They were so excited about her model, they want to adopt her model as well. Like a couple of months before her arrest, a lot of people were talking to her, to meeting with her to talk about new projects. She was very excited. All the collaborators were excited. Now, because of all these charges, her reputation was tainted, and the people are so fearful that they cannot step forward and engage with her on all those collaborations.
I want to take a slightly different turn here, and we're almost out of time, but just a slightly different turn. If we were on the West Coast, if we were in Seattle, Portland, San Francisco, the Asian American community, the Chinese American community would be very large. It is not extremely large here. What has it meant for your community to rally behind Sherry Chen? Has this been important for you in maybe an ongoing and larger way, Shau?
Yes, I think as an Asian American leader at both the national level and the local level, I know very well, the components of, Asian American in different states. But I think Sherry Chen issue is definitely a national issue, if not international, because during this rally, we actually got people from supporters from California, from Iowa, from Indiana, from DC, from somebody drove 9.5 hours in the snow from West Virginia. So we had
take
people,
part in the demonstration the other day?
Yeah, they came to join the demonstration. They came to listen at the court for 2 full days. So we, and our men and women, young people and older people, the oldest supporter we had was a Japanese American who was 82 years old. And the youngest is in the 20s. So, my daughter actually. My daughter came and she was 18. So I think it's a really community rally, and everybody who share the same American value of due process and fairness and justice. We came together.
I thought it changed things from a situation where when I met with you, we were in a Mason classroom with 50 families, all middle class, hardworking, saying, how do we not become Sherry? And she was holding programs with him across the state on how to protect oneself against charges of espionage. to stepping up and saying, you know what, we're good Americans, we will stand with each other and we will not accept this life of fear of the next attack, the next false charge, the next allegation.
And in that sense, it's a metaphor for the entire American history of minorities and what they have had to do over time in order to become totally integrated into American society. Thank you very much for being here to explain this, and I'm hoping that Sherry Chen will be able to join us in the weeks ahead. So we'll see where all of this goes. Stay tuned. After the break, a local view of the healthcare debate in Washington. Welcome back. The debate in Washington about health care has been cast as everything from repeal and replace to overdue reform of the Affordable Care Act sponsored by the Obama administration. However one characterizes it, what is happening in Washington, it is enforcing elected officials to clarify their values. The American Medical Association, the American Nurses Association, the Academies of Pediatrics and Family Medicine, physicians have, as well as other national professional associations, have taken stances against what has initially been presented as the Ryan-Trump proposal. But ultimately, health care is delivered locally by specific doctors, specific nurses, pharmacists, therapists, interacting with specific patients. For the most part, these local organizations are not going to become directly involved with the national debate because no matter where the policy ends up, they'll still have to deliver care. To begin our discussion of the implications of the proposed health care reform on local delivery level, I am joined this morning by John Fishpaw, the Vice President for Advocacy and Government at Mercy Health. Mercy Health is a not-for-profit health system that operates 23 hospitals in Ohio and Kentucky and is the fourth largest employer in Ohio with 32,000 associates. John, welcome back to Newsmakers.
Well, thank you, Dan.
As I was trying to say, this is not a discussion so much directly of the proposal out there because Mercy has not taken a position. Most other hospitals locally, that's not what you do. But I want to talk a little bit about sort of where you stand because you've been working with the Affordable Care Act for the last 7 years or so and have had to implement that. So let me ask a couple of questions about where you stand and how the impact of that. Has that changed the experience that you've had in the number of patients coming into your hospitals who do have insurance, and therefore you're getting, you know where you're going to get paid?
Oh, sure. I'd like to first say that the Affordable Care Act, when it was first passed, it did one thing without any doubt. It really forced providers like hospitals and physicians, consumers, social service agencies, as well as insurance plans into the same pool. So while we're all standing at one end of the pool, the same end of the pool, we all have really the same end goal in mind, that being to get to the other end of the pool. Although those different stakeholder groups I just mentioned all are trying to get to that same end of the pool by a different stroke. So that being said, the Affordable Care Act as a whole has done some good things. One good thing that it's done is provide preventative care to those in need. And so trying to keep our population in all of the communities we serve as healthy as possible, trying to keep them out of the hospital is really our goal. Because let's face it, Dan, nobody really likes going to the hospital.
Yeah. And one of the elements of a hospital is the emergency room. And there was a lot of talk 8 years ago about, can we change the way emergency rooms are used so that people don't use them for primary care?
Sure.
Have you been able to document in the Mercy system that the people who are coming to your emergency rooms are different, that what they're presenting with is different than what used to be the case?
I don't think they're presenting much differently. What we have done in some facets of Mercy Health has been able to expand our primary care network. But we're seeing fewer individuals go into primary care medicine, largely because many of these people who go into medicine and are leaving medical school with a high debt load. So that being said, there have been many more going into specialized medicine, less that we're seeing coming into
where the salaries
primary
are
care.
much higher.
Correct.
So,
and
but
so
primary care is always been seen as sort of the base and was seen as essential in the American Affordable Care Act.
No doubt. In fact, it's one of those key parts of the overall safety net for any community, large or small, urban or rural.
Well, the concept of having a medical home was also talked about. That that people had a primary care physician. They knew where they were going to go for their regular care.
Sure.
Do you have a sense that we've changed that more people do have primary physicians?
Sure. In fact, one innovation that was derived from the Affordable Care Act is what is known as the Accountable Care Organization. So Mercy Health has an accountable care organization. It's called Mercy Health Select, and we have over 65,000 patients who are part of that accountable care organization. So it's allowed us as a hospital provider, a health system actually, to work very much in a more strategic way to partner with our physicians, providing those patients with not only accessible care, but more care that is deemed innovative, quite frankly, from the standpoint of our being able to perform at a higher level with regards to quality outcomes. Because one thing is for certain, no matter where this current debate is going or where the Affordable Care Act has gone in the past, we are going to continue to provide high quality care at a level in which provides our patients and our communities with affordable access.
And I think it's one of the changes, and I'm not sure that it's because of Affordable Care Act at all, but one of the ways that healthcare has changed is that hospitals now have more physicians working out in the community who are, in your case, Mercy Health physicians. You put together these physician groups. There's not as many single or two doctors out working on their own anymore.
That's exactly right. There's been more consolidation among the physician audiences or physician groups in this community and in other communities. And we're seeing overall more consolidation as a whole when it comes to providers and insurance plans, quite frankly.
And do you think that is a good thing for the quality of preventive health?
I think that there is a case to be made for strength in numbers. And I think that when you have strength in numbers on your side, you're able to operate even more effectively and more efficiently.
One of the other things that the ACA pushed was the digitization of records so that records could be shared across the system or across systems if patients asked for that. Has Mercy undertaken that? Have you gotten to the point where all of your records are now digitized?
In fact, our health information technology platform is a consistent one across the system. In addition, we started making that investment even prior to the passage of the Affordable Care Act, recognizing that we needed that type of infrastructure to become that much more effective and efficient with our patient care delivery.
So at this point, on the national level, there's a lot of talk about Obamacare. Sure. I try to use ACA because that's the official name, is a terrible disaster. Is that your experience as a healthcare system, that it has been has it been a disaster for you? Let me put it that way.
I think it's been a mixed bag, quite frankly. I think one of the innovations that have come forth through the Affordable Care Act is what I mentioned earlier, the accountable care organizations. And again, we have an accountable care organization in which we've been able to deliver, I think, pretty effective care that way. It's been a mixed bag, though, because of the regulatory effects. We have just seen a cascade of rules and regulations come our way. Keeping pace with those rules and regulations has been a little bit of a challenge, quite frankly, just because of the cascading effect that they have had.
And I'm almost out of time, but one of those types of rules and regulations is if a patient is released and comes back too quick, the hospital doesn't get paid. Is that right?
That's right.
Has that changed your performance?
There is a readmissions penalty for those returning patients who come back to us for a condition in which they were previously discharged for. That has changed, I think, to some degree our performance and has allowed us actually to wring out some of the variation in our own services.
Okay, unfortunately I'm out of time, but thank you. Sure. And thank you for making Newsmakers a part of your Sunday morning. Next week we will continue to probe the local implications of the current healthcare reform efforts in Washington. Have a good week. John.